If you have been told that you have IC and your bladder is a problem, and all you need is this one pill, this one procedure, this one specific IC diet, and it is going to fix all, you need to hear this. You have been solving the wrong problem, and that is why nothing has worked. In the next few minutes, I'm going to tell you 5 truths that your doctor is never going to tell you because they don't have the time or the resources. You've tried the meds, you've tried the supplements, you've tried the general route of treating the IC, and yet you're still here. It's not because you haven't tried hard enough. It's because you've been chasing the wrong problem. Let me say this very loud and clear. Bladder is not your first problem. My name is Dr. Sonal Barad, Doctor of Physical Therapy, board-certified pelvic rehab specialist, and for the last 22 years and over 40,000 clinical hours, all I have treated is bladder pain. I have lived it, I have researched it, and I have treated it for 2 decades. You're not going to find anybody better than me when it comes to treating your IC. I'm about to tell you 5 facts and 5 common patterns that I see over and over in these women that I treat. Once you see them and once you know what they are, you're never going to be unseeing them. And it will completely change the way that you look at your IC. So let's get started. Number 1, your bladder is simply reacting. It is not malfunctioning. Here's how I see it. So when you get the signal from the bladder that, hey, you've got the urgency, there's a lot of burning, you're peeing fire is the symptom you see, or you're just so scared of the flare-up, or here you go down the flare-up, you're going to the bathroom every minute, every 10 minutes, 5 times at night, and you're thinking it is a bladder problem, right? You're so focused on the bladder, and you go see, hey, I need to go see the doctors, I need to treat the bladder, and you're focused there, and you're doing that, and nothing's really sticking. Here's how I say, when I say that it is not malfunctioning, it's just miscommunicating. It's interrupting it wrong. I want to tell you a little story here. When you went to school, we learned about these experiment that is Pavlov's dog. You know, the scientist who trained the dog. When the bell would ring, the dog was given a food. Now that dog is conditioned that once the bell rings, it's ready for the food. So what does it do? It starts salivating. Now we see the pattern. The bell rings, the dog salivates, and you get the food. Now they take away the food. So when the bell rings, the dog starts salivating. Now we're all so focused on that dog. But what everybody is missing, and especially your doctor that's missing, is we're so focused on treating that dog that we're not really looking at who is ringing that bell. So that is the number 1 thing that I see over and over again, that we're so focused on the bladder that we really miss the big picture. Number 2, everybody is treating this their own little corner in isolation. Treating an IC is not a bladder problem. You don't treat it as a bladder problem. It is a system problem. I'm going to give you another example here. Let's say you have a window. I have a window here. It's leaking. You call the plumber, fix some pipes, and it holds for a bit, starts leaking again. Now you're sealing, you're finding somebody who seals the window, then you find somebody that caulks it, and then you find somebody that changes the frame. And every time somebody comes and addresses that window, it does hold up. It looks like it's the problem's fixed. But what's really happening and why it keeps leaking is because nobody's looking at the foundation of the house that has shifted, it has misaligned, and that has thrown the alignment off of the window, and it keeps leaking. Unless you address that at the root, at the foundation, that window is going to keep leaking. You're not going to resolve it forever. Permanently. Something will stick. So how you apply this in the bladder is that you're going to urologist, some meds, some procedure, sticks, maybe it's hydrodistension, maybe it's some Botox, installation, anything it is, it will stick. Then you go to your naturopathic doctor and they're treating the gut because they think it's a gut problem, throwing 47 different supplements and your cabinet's full of supplements by now. Then you go to pelvic floor physical therapy, and when you go, it feels great because they're stretching that pelvic floor, their manual therapy on it. You feel great, then you stop, and then it's back where it was. Or you go to a gynecologist. There's a hormone treatment replacement therapy is a big thing now, and everybody's on hormone replacement, which is a great thing, don't get me wrong. But then you are treating the hormones. And so everybody is treating that little corner they think might work, but nothing's really sticking because nobody is looking at the actual foundation. So unless you're connecting the dots, unless it's an inclusive approach, you're not going to find a solution for an IC, just one solution that's going to stick. If whatever I'm saying is starting to make sense and you want to know more about how IC has been approached, I'm going to share here my last 22 years of my experience treating these women with IC and bladder pain. Hit subscribe and keep an eye out. Number 3, there is no single fix. I know we talked about that, but let me give you an example of it. I had a patient named Diane. She had IC pain. She put up with that for last 11 years. She lived with it. She tiptoed around the flare-ups, will watch everything she ate, gave up coffee, gave up everything, would not enjoy time with her kids, all of that. She's been through urologists, gynecologists, naturopaths, spent thousands and thousands of dollars. When she came to me, it's because she went to a gynecologist that she trusted, and he said that, hey, you know what? Hysterectomy is what's going to solve it because this is this one problem, and if you have one fix, it is going to solve it. So she went ahead and had a hysterectomy. Of course, it didn't get solved. And of course, now because you've got scar tissue and inflammation and you have the procedure done, and now she's in the worst place ever. She's been dismissed by the doctors. So what I meant by that is that IC is not going to have one fix. You really need to look at the root cause. How I treat it in my clinical practice is there are main 4 root causes. There are 4 codes that you need to find. And as I'm explaining those 4 codes, just keep an eye out which one is making sense for you. Okay, so my first code is you are doing just fine. Then you have a little stress, you're stressed out, something is making you anxious, something's going on in your life, and your bladder is acting like that too. Nothing happened to the bladder, but the way you're wired and stressed and moving around your day is how the bladder is flaring up with it. To me, that is a nervous system code. That's an alert code. That's when your nervous system is set and your bladder is so tied into that nervous system, it's just reacting however your nervous system is reacting. Number 2, if you're that somebody who's either done rounds of antibiotics or rounds of antibiotic and yeast, then you're going to have some gut microbiome that's going to be compromised. For my practice, I call that a gut chaos. Number 3 is where these are women that feel great when they go see a physical therapist and they stretch and they do manual therapy and they do all of that and they feel good and it feels relieved. But when you stop, then you're back to where you were. This is a protective muscle code because whatever they're doing, it's not holding up. You're not holding that expansion. Something is driving that protective mechanism that you're just going like this right after it stops. So that's going to be your muscle protective code. Number 4 is your what I call a signal messed up. So this is for women. If this is you got this urgency and you've got this pain and you feel like your bladder is so full because there's tremendous pressure there and you have to leave everything you're doing and you run to the bathroom and then you go pee and be like, that wasn't a whole lot. So whatever the output was, it didn't really match the drama that the bladder had, right? So the drama the bladder had would be like, oh my gosh, it was like a full bladder and you peed so much. The drama that the bladder had was so much is going on where there's just a little bit of output. That is a signaling messed up. Okay, so out of these 4 codes, see which one applies to you. And it doesn't have to be this one or that one. And clinically, usually there's a combination of 2 or 3 or maybe 4, all of them. So that is going to be your root cause. That's where the IC is actually coming from. Now that you know what the root cause is, let's see what we can do with it. And that's where the number 4 comes in. Do not put Band-Aid solutions. What I meant by Band-Aid solution is IC diets. You started with just eliminating the coffee and the alcohol, and then it's gotten less and less and less. And now you're eating 3 things. You're not even enjoying your meal. You forgot what it was like to have some joy in a meal, which is not good for you because now you're probably malnourished. Because if you're just eating those IC diet foods, then you know very well it's not very inclusive and it's not good for your gut. That's probably going to make your gut even worse because now there's no diversity in your food. So let's not treat that with Band-Aid. The other example I can give you about the Band-Aid is the antibiotics. Whether you have the infection or not, antibiotics do have some anti-inflammation properties in it. So quickly you think you have UTI and you get antibiotics, And you may or may not have it, but you're getting those symptoms because the UTI symptoms and the actual IC symptoms are so overlapped that you really don't know the difference by now. So when you have that, you call in the antibiotics and you take it. Every time you're taking it, you're wiping out those guts microbiomes. And now you're actually going to be more, exposed to the bacteria. So just because if you have a symptom, every symptom that pops in your radar, you go chasing that bladder symptoms and you start treating it, it is not going to stick. It's doing you more damage. Let's take another example about the urgency. You feel like you have overactive bladder or an urgent bladder, and you're going to the bathroom over and over. You keep going to the urologist, and finally, they have convinced you that all you need is this spinal stimulator to put in your spine, and that's going to take care of it. I cannot tell you the number of patients that I've seen with failed spinal stimulation, Interstim, or whichever other brand is. What happens now? Yes, it suppressed the signaling for a bit, usually don't work after 2 years, and now you're left with these wires permanently clamped on the nerves, the hardware in your spine, and the machine little box that goes in your spine that doesn't work. Do you see, when you try treating the symptoms, you're actually doing more damage to your entire whole ecosystem. And now it's getting harder to treat the bladder and the whole system. If you don't take anything from all that I have talked about, and if you only focus on the root cause and try to find your root cause, you will be saving yourself so much trouble. Stop chasing these symptoms. Stop going after one after the other and just chasing it. Look deeper. I know our medical system is not set for it to look deeper in your bladder, but think about where and what's really happening in your body, in your system. Ask yourself this question: what really happened? What started it? Where is it? Where are you seeing the most of the pattern are connected into? Out of those 4 codes, I bet you it's one of them, some of them, or all of them. Final one, number 5. Let's start treating this, okay? Now, let's start connecting the bladder brain. Now, I'm going to give you a generic exercise here, but what's more important for you to know that there is no one set protocol that's going to apply to every single IC. For the last 22 years, I can tell you, I haven't seen 2 bladders that are exactly alike. Yes, they have a spectrum of symptoms and they have certain patterns, but they're never the same. Okay, so I don't have a protocol that is going to be exactly the same and it's going to apply to everyone. But let's learn about how can we apply something minimal, put some awareness in it, put some thinking in it, and see if we notice some changes and see what happens. One of the best things, I'm sure you all have heard about, train the nervous system, take the breath and do box breathing and what is this, 7 some breathing and whatever it is, whatever your breath is. YouTube video like this and you'll be like, okay, take a deep breath and do a diaphragmatic breathing. Let's see how that looks. Put your hand on the chest and one hand on the belly and see it rise and fall. Let me tell you, that's garbage instruction. Yes. What you really want to know and bring the awareness at is that where is the breath going? So today we're going to talk about the diaphragmatic breathing. So your diaphragm is not in the belly, okay? So the diaphragm is actually into the ribs. So whether you're sitting or standing, preferably sitting with a little nice comfy sitting, and go ahead, close your eyes, put your hands, put it on the rib cage, on the side of it, here or this way, okay? And see if you can breathe into your hands. Right where your hands are is where the diaphragm is. It's not in the belly. Now you've closed your eyes, put your hands on that rib cage, and now go ahead and take a nice deep breath. When I say nice deep breath, it's not like that, because what just happened when I did that? Everything just went in my neck. Do you see my shoulders going up? Not a good breath. Okay, all right. So let's do this again. We want to put the hands on the rib cage and we want to relax the shoulders. We want to breathe in so nice and so gentle that if somebody's sitting next to you, they don't hear you breathe. You don't hear yourself breathe. That's how slow and nice you want to breathe. So let's go ahead and close our eyes, put our hands on the rib cage, nice and firm so you feel what's happening. Now go ahead and breathe into those hands. Think about those fingers being stretched outside and making some space there. Pause for a second and breathe out nice and slow through the nose. Mouth is closed, but go ahead and breathe in and breathe out. While you're doing this, the reason you're closing your eyes is because you're focusing on where that breath is going. Very, very important. The diaphragm's here, the pelvic's here, the bladder's in the pelvic. The better the diaphragm moves, the better the pelvic moves. And we're not really trying to move the pelvic right now. We're just learning to move the diaphragm and to breathe. One of the main reasons, I'm sure we all have heard about the vagus nerve, it's a new culture. That vagus nerve, the nerve that comes from your cranial, from your brain, goes all the way down. It's going to your gut, but it's passing through the diaphragm. The more the diaphragm's up and stuck like this, the more it's going to be irritated and triggered and all of that. So the reason for us to do the breathing and really feel the diaphragm move is because we want to move that vagus nerve. We want to bring some calmness there and we want to strengthen it. The more you move the diaphragm, the better the vagus nerve is strengthened. So please, please, please focus on how you're breathing. Where is that breath going? I see is not a life sentence. You're not broken. The bladder's not broken. You've been sold the wrong solution by the medical system. It's let you down. Let's implement all that you've learned in this video today and think about it and start applying to where your symptoms are, what's happening, and stop looking for the short-term Band-Aid solutions because it's not really fixing it. If this all makes sense, keep an eye out. I'm going to be posting more videos here. We're going to dig deeper into why does your bladder feel like it has a UTI when you don't really have one and the tests are coming normal. Please keep an eye out. Click the link below. See you on the next one.